Welcome to the UMA podcast. My name is Dr. Kamara, and I'm here with Dr. Sechanzi. Yes. So, Dr. Sechanzi, first introduce yourself real quick, and then I'll introduce myself again.
Okay, thank you very much, Dr. Kamara. So my name is Dr. Sechanzi Henry. I'm the CPD chairperson. CPD is Continued Professional Development for the Uganda Medical Association. I'm a medical doctor, and I'm super honored to be here.
Okay, thank you. My name is Dr. Kamara Ivan. I'm the Vice Chairperson of UMA Central Branch, and I'm pleased to be here with you, Sechanzi.
The UMA members, and I think we're looking smart in these UMA t-shirts.
Yes, we love the UMA shirts. So, Dr. Sechanzi, we are going straight to the point. Medical interns in Uganda. What's the issue surrounding medical interns in Uganda? We are hearing a lot about medical interns. Medical interns are up in arms complaining. The medical fraternity is up in arms complaining. What is the issue around medical interns in Uganda right now?
Well, there's a lot. I can tell you there's a lot about medical internship. But for starters, every year around this time, for the last about 10 years, this discussion, these debates about medical internship have always risen, and seemingly it's a recurrent problem which always continues. I don't know when it will end, so and issues usually rotate around remuneration, delayed payments, some new policies and all that. But currently there's a new policy that was introduced. I'm sure our viewers out there have at least heard something about this new policy. It's called the NETH policy, but basically it's a new medical internship policy that tries to streamline how medical internship is done and conducted in Uganda.
The NETH policy, what is the NETH in full?
So NETH is the National Education Training for Health. Okay, so NETH is the National Education Training for Health policy. It's a new policy that has been drafted this year, and it has quite a number of adjustments from the usual internship practice. So normally, interns have been doing a 1-year internship that is paid. At least they've been earning some money. At least for the last about 4 years, they've been earning about $1 million per month. And they were under the supervision of supervisors, and everything was conducted under hospitals where they're doing the internship from. However, with the new NETH policy, interns, internship is going to be shifted from being a hospital-controlled training process to the university. So they're sort of trying to push internship back to the university, and they're making it seem like interns do not graduate I don't know if I should call them medical students or interns, but we all know that someone starts by being a medical student and become interns. But I feel like for purposes of this discussion, I'll avoid the word medical intern and I'll call them medical graduates. So graduates are required, can only graduate after they have completed this medical internship, which wasn't the case before. So before you would finish school, graduate, some people actually would graduate before internship. Others will graduate in the middle of internship. I remember for me, I graduated when I was doing internship. That's the Makerele calendar, allows for people to graduate during internship. But with the new policy, someone can only graduate after they have completed the internship.
Okay, so basically, at first, medical students would graduate, become medical doctors officially, and then do internship.
Yes.
But now, internship is being moved from where it is to being part of the medical training.
Excellent. Maybe what I can correct a little bit
is trying to do, which we are fighting against.
Exactly. Yes. Maybe what I could correct is, back in the days, regardless of whether you've graduated or not, it wouldn't matter. As long as you've passed your exams and your medical school has sent your name to the ministry that you finished medical school, you become an intern, regardless of whether you graduated or not. That's why I was giving an example that for me, when I was a medical intern, actually I graduated when I'm already an intern, and that's what many of the universities do. The moment people pass their exams, their names are forwarded, they start internship, then usually graduation comes later because the university calendar and policies are usually different from what the Ministry of Health was doing. However, with a new policy, like you put it right, it's going to require somebody to first finish internship before they graduate. In other words, they're making medical internship to be part and parcel of university training.
Yes.
And that's a bit of a challenge.
Yes, because So I think what people should understand is this: medical interns, they are not. When people hear interns, they think these are people that are not yet ready to work. But in the medical field, that's not the case. So the way it has been before, medical interns are people are fully qualified doctors, and they are just working under supervision because we are doctors, we deal with human lives. Okay, so your first year of working has to be under supervision, even though you are fully qualified. Your first year of working has got to be under supervision, and that's what we call medical interns. And that's what people are confusing with other interns that are still under training. Our medical interns are not under training per se. They are fully qualified, but now they have to work under supervision. And then I must add, we have to add this, that medical interns are actually officially a part of the healthcare structure.
Definitely.
Yes, they were considered, and their role was actually catered for in the whole healthcare system. They were catered for. They are considered a part of the healthcare structure. So they are not disposable, as as it would appear. It's seemingly they're trying to make it look like these people are disposable, but they're not disposable. It's how we have. It's just like we have consultants, we have medical officers, we have nurses. So medical interns are a part of the healthcare structure. They are not students. When they were creating the healthcare structure, worldwide, by the way, they are part of the structure. When
Everywhere.
when they are creating the structure, they're just like residents. When they are saying this is how the healthcare structure looks, there is a place for residents, there is a place for medical interns.
There's a place for consultants, there's a place for medical officers.
Yes, they are just unofficial employees. I could use that term. They are actually employees, just unofficially. And that's where I think the public is a bit confused, because when we say medical interns, it sounds like these are people that are not qualified.
No, the people equate us to like that the teacher interns. I don't know if you remember those school days when we were in high school, and they would bring these interns who are still in university, maybe their second year of doing their education courses, and they're coming to do teaching practice. So we are different from that kind of arrangement. So even us, actually, we go through that training. When I was in Makerere, we used to have what you call COBAs. It was community something based learning. But you go into the communities, see what happens in the public there, treat people. Yes, at that time we were also interns at that time. And I really feel like we need to change the terminology of medical interns to something else.
Perhaps we need to change the terminology,
it's sort of
because
a misnomer. Yeah.
The term intern is confusing people. But yes, medical interns in Uganda, these are fully qualified doctors and nurses and pharmacists, but because they just have to work under supervision the first year of work. That's basically what it is. Yes, and now the policy is suggesting that this internship is made a part of training, and we are thinking that this is they are trying to dodge the issue of paying them by calling them students, by making it a part of the training and making it that these are students and are not entitled to any pay. So I don't know what you think about that.
Well, but then that's just one part of it. The other part of it that's very interesting, yes, we've talked about the issue of payment, but then also there's something that's coming up that will be a discrepancy in the payments. So with this new policy, government is proposing that it wants only to pay those graduates who were under government sponsorship. You realize that most of close to half of the medical interns were sponsored by government in their training, undergraduate training. And with the new policy, it's only those that were sponsored by government during undergraduate training that will continue to be paid during internship, and those that were privately sponsored, the new policy puts it that they'll not be paid by government, but instead they have to be catered by their guardians. I don't know what to think about that.
I don't know. It would. Does it seem fair? Because someone could reason that, well, that's fair because if you got a government scholarship to go to medical school and do medicine, then the government was sponsoring you as a medical student, they can continue to sponsor you as a medical intern. But if you did not get a government scholarship to go to medical school and you decided, I will sponsor myself, then the government is saying, you decided to sponsor yourself, continue and sponsor yourself, even for internship. And so someone could think, is that fair or not? I don't think it's fair. Once again, because when you're an intern, you've passed the stage of being a student. You are already fully qualified as a doctor. Whether the government sponsored you, whether you sponsored yourself, you are all now fully qualified doctors, and you're supposed to work in the healthcare system under supervision for 1 year. And so you're no longer students. So to me, it's still not fair because this is a different arrangement altogether. You can't tell someone that because you sponsored yourself as a medical student, go ahead and sponsor yourself for internship, as if they're trying to connect the two.
I mean, and if you pull it a little bit backwards, realize that people who actually qualify for these government sponsorships, most of the time, are people who are studying in very posh schools, very expensive schools. Have you noticed that there are schools, high schools, secondary schools that pay more tuition than universities? And this is where these guys started from. I'll not mention names, but you all know that usually university tuition around Makerere is around 1.5 to around 2 million. Okay, even if it's 2.5, and that's per semester. And the semester probably will run for about 5-6 months. If you compare that to a student who is, and there are people who are paying this money for just one term. So someone pays this money for one term and a year has 3 terms. That means they're paying probably 7.5 million, way much higher than what they're going to pay at the university. So realize the people who actually get government sponsorship are people who have been studying in these posh schools. They're the children of the rich. They're the ones who are getting government sponsorship. And then after internship, they're going to continue to be paid. And then these other ones who are struggling, they struggle through school, maybe not very good schools. They don't get government sponsorship. They have to hustle with tuition in university, and then again the burden is going back to them.
And now we come to the issue of return on investment. Yeah. So there's also this sentiment because medical school is very expensive financially, socially, emotionally. So you go through medical school, you pay a lot of money. The parents of medical students pay a lot of money, so that you're spending a lot of money, and then you at the end of medical school, now you continue, even internship, you continue to spend more money because you're going to support yourself as you do internship. You're going to support yourself. You're going to pay all your living expenses by yourself, on top of being in the hospital 24/7, meaning you do not have the option of even looking for income elsewhere. So that the expense of it all with just no return, I think is another huge sentiment in this.
Very.
I've been spending money my entire medical school 5 years. I've been spending money now. Internship, I'm once again spending money, not getting anything back. And mind you, I am adding some value to the system. Yes, I am all this year of internship. I am adding a lot of value to the system because I'm in the health. I'm part of the healthcare system,
definitely
offering healthcare to so many people, and not having any time to pursue my own interests or other sources of income. Yeah, so there's also this sentiment of zero return on investment.
quite disturbing times. And also, I don't know if you've come across this news that there's a proposal that yes, much as they're going to be paying these guys who have been sponsored by government, those who are privately sponsored, they're only going to provide them with meals. So that means that if you were privately sponsored and you're doing this internship, the only reward you'll get for your work done is a meal. Of course,
I found that, I'm sorry, I found that a little demeaning when I first saw it. Yes, it's a good thing. I would appreciate meals being given to everyone. But when I first saw it, that they're going to give them meals, it was so demeaning, almost like it's, who do you give meals? It's almost like you're, I don't want to use the word animals, but it's our pets. It's animals that you give. I'm just going to give you meals.
You see?
And you're going to work, and your payment is a meal. And
these people are dealing with human life. I don't know.
It was so.
I'm sorry.
It just sounds demeaning.
You can walk into a facility probably with an emergency, fetal distress, obstructed labor, all those complications, and you're going to be attended to by this intern whose only payment is a meal.
Yeah,
can we avoid distortion? The thing of distortion.
Who gets paid with meals, with a meal? So the meal. Yeah, the meals. That was it about the meals for me. I said, who gets paid with meals? But it's a good thing, of course. If they can get meals, they should get meals, and even just for in the basic humanity context, I think all interns should be given a meal. Yeah. Why on earth interns are in the hospital 24/7? Why on earth wouldn't everybody be given one meal? And
not only meals, accommodation. I did my internship in Kabale, and I had some difficult time there that you had to cater for your own. By the time I did my internship, they weren't intern mess, so that was intern mess. That means that we had to cater for our meals, we had to cater for our accommodation, and accommodation would really take you like a quarter or even a half of your entire allowance. And where I was staying, I just needed to use the border to reach a facility. So you realize that without support, it really becomes difficult for somebody to be a good intern. You cannot perform your duties well. I've seen one of the conversations going around, one of the consultants saying that, so if this intern is not paid and they're coming late, maybe they're not decent, they're hungry, as a consultant or maybe the supervisor of this intern, I'm really going to to question this intern for where they have been, for why they are not on time, for why they are coming late. You're not paying them.
And now, this is why they want to make it. This is why I say it's very cunning. It's like a cunning and a trick to make it part of their training process, medical school process. Because what you've said is what they're trying to eliminate. They don't want there to be a consultant now is going to, if internship is part of your medical training and you've not yet graduated, then the consultant is going to be very well within their authority to ask you to demand that you're on time, that you fulfill all your duties, because it will be looked at as you're still a student. You signed up for this. You're supposed to do this. So it's a trap.
Very, very much of a trap. But anyway, hope maybe this issue can be resolved. So actually, the budget just came out. We're just ending this month of July, and it's a budget month, and the budget just came out.
So now let's talk about the budget, because that's what has that's the most recent. That's the most recent issue. So they released the budget for the first quarter, and they released 7 billion for the first quarter for interns. So break it down for us. What is this 7 billion going to do, and why are we not satisfied with it?
Well, 7 billion is small money. It's laughable for a person like you to say that 7 billion is small money, but I mean, because I don't have a 7 billion. But well, the point is 7 billion is not sufficient for a whole lot of interns that we have.
Let's break it down. What is the 7 billion estimated, in our estimate? How much is going to go to interns? How much is going to go to SHOs?
Yeah, so of that 7 billion that was released, But before even I break it down, I need our population, our viewers out there to know that currently we have about 2,300 medical interns. And this includes doctors, pharmacists, dentists, and nurses who are going in for internship. And actually, their internship is supposed to be starting just a few days to come, because we are ending July and internship is supposed to start in August. So, and this money that was released, the 7 billion, is what is supposed to pay these people. However, as that 7 billion was released, there are some areas. So the people, the interns who are finishing their internship, some of this money is supposed to cater for their areas for the last about 2 months. So probably that money would take about...
so we estimate about 2 billion.
About 2 billion, yes, just to cater for areas.
Cater for just the areas from the previous interns.
Yes.
Yes.
Then we have what you call the senior house officers. Our people may not know what senior house officers are, but basically these are medical graduates who are doing their postgraduate studies. These are the so-called SHOs, people who are doing Masters of Medicine in pediatrics, internal medicine, in surgery, anesthesia, ENT, just to mention about a few.
They are doing their masters,
yes,
but they are also working in the hospital and are also part of the healthcare structure officially. They offer services in the hospitals officially.
So these guys, of course, right now, there are quite a number of universities which have these postgraduate courses. Makerere is one of them. Barala is one of them. KIU is giving these postgraduate courses. Busitema and other universities. And these people are also paid some money because, like you've described, they are doing work. Much as they're studying, they're doing work, they're seeing patients. So these people are at least paid some money. It's not good money. Sometimes I'm embarrassed to mention that that's the money I've been earning for the last about 3 years when I was doing my MEd program. But yeah, they just earn about 1 million.
So how much of this 7 billion, now out of the 7 billion, how much are we estimating is going to go to the senior house officers?
It's about 1 billion. So if you add this 1 billion that has to go to these senior house officers, plus the other
2 billion,
2 billion for
areas,
for the interns, that makes
we are already down by 3 billion.
Yes,
3 billion. So we only have 4 billion.
So of the 4 billion,
of the 4 billion,
yes, is one that is supposed to cater for the coming cohort of interns.
For the first quarter.
Yeah, for the first quarter.
Yes.
So if you did the math very, very well, this money is just like a half of what is required to pay every intern. That 1 million. So that means that practically these interns cannot be paid this 1 million for this first quarter, implying that seemingly
how much they're going by the amount we have. How much is an intern going to be receiving per month? So about how much?
Yeah, so of course, as of now, the calculations are not yet out. There's no official communication that has been put out, and we don't know if it's a trick or it's a political move not to reveal the actual figures. But if you did the math, currently, if you got the number of interns we have versus the money that is there for the first quarter, which a quarter is 3 months, each intern could just get about 500,000, which is a half of the money. And this implies
would get about 500,000.
Yeah, about 500,000.
And yet the amount that was promised initially was supposed to be 2.5 million.
The 2.5 is actually another story. We are going to come to that.
No, I mean,
but for now, let's start talking about 1 million.
We are now down to 500,000.
Yeah.
From the 2.5 was an official agreement, by the way. The 2.5, signed by the president.
Yes. We are going to come to that 2.5. that
but
was
now we are down to 500,000.
Yeah. Wow, interesting. But even before we come to that, interns have been getting like 1 million per month. It has been standardized for the last about 2 to 4 years, at least 1 million. But now we've been downsizing this from 1 million to the 500,000. It's not yet clear whether this is the money that they're going to be getting. However, if you extrapolate with what is in this policy, it's as if this money that is in the current budget, the 7 billion which has been released, is what is enough to pay 1 million to these interns that were sponsored by the government, and then also buy meals for these privately sponsored students. It's not yet clear. And I mean, please quote us right. We are ending July. Yes. The communication hasn't come out yet.
These are our estimates.
Yeah, these are our estimates.
Based on the money that has been released for the quarter.
Yes. So of course, as details come in, maybe we shall be discussing this a little bit more. But as of now, if things are to go by they are, if this money is not increased, interns, it's likely that either interns are going to be getting 500,000 per intern, or the government-sponsored graduates will continue to earn the 1 million. The privately sponsored students will just get a meal.
It looks bad on both ends.
Very, very bad.
Yes. So now, but the question, let's also answer one question, or to re-emphasize. Something people ask, is this money worth it? Is it worth paying the medical interns 2.5 million shillings per month or 2 million shillings per month? Is it worth it?
Well, the answer is obvious. It's not worth it. The answer is obvious. It's not worth it. And if you compare what Ugandan...
is it worth... is it value for money to pay medical interns 2.5 million shillings per month?
I even don't know why you're rushing to the 2.5, which was last paid about 4 months
because
ago.
that's the official, that is the amount that was initially agreed upon. Of course, a couple of years ago, it was agreed upon. Although over the last few years, the amount has dwindled among so many back and a lot of in between all that back and forth. But that was the original amount. So is it value for money? To pay these medical interns this amount of money? Is it worth it? I mean,
okay, I'm going to answer that, but before that, let me just give you a bit of background. If you looked at what interns in the neighboring countries are earning, you'd be surprised. People are earning way much more money than we are earning here. So literally, like in the whole of East Africa, I think we are the country that pays the least amount of money to the medical interns. Of course, that's a red flag on its own. Why would we be the least? There are places where...
the first thing is worldwide.
Worldwide, yes.
Medical interns are paid because it is acknowledged and it is known that they are part of the healthcare structure. Regionally, they are paid, and much more than in Uganda. So, like, just off the bat, that's one reason.
Good.
But then carry on.
Yes, before I also go back to your question, I'll give you another scenario. Is that a medical intern, they are doctors, they are pharmacists, they are doing work, they're doing professional work. And some of this work can actually be cost. Like, you can cost whatever they do. Okay? I'll give you an example. A medical intern does cesarean sections. Me, when I was an intern, I don't know how many I did, but we did so many cesarean sections. When
I was in Obscane, at least I would do 3 every 2 days. I would do about between 4 to 5.
Those ones I would do in one night.
I was up country, so in a week I would do about 15 to 20.
You see? Now the question is, what is the average cost of a cesarean section around Kampala currently? And it's actually about at least 1 million. 1 million to 2.5, depending on where you are.
Minimum is 2.
Yeah. So and if you have an intern who does 3 or 4 in a day, how much money are they generating? How much money are they saving the government? How much money, So, like, by and large, the money they're earning is too little. But then I'll go back to your question of whether it's worth. Definitely, it's worth paying interns. Like we've said, interns are paid all over.
They give value for that. The value
for money is there. The value for the money is there. But I think what the challenge we have in our setting is maybe, I don't know what our policymakers are really thinking. I don't know what these people who make these policies think, really. But I just feel like I find it really inappropriate for them to be paying this little amount of money. And one other thing we are forgetting that most of this money doesn't come on time. Most of the times it's paid quarterly. Like we've seen this 7 billion which was released. So people are going to earn money for like 3 months at once. That means someone has to stretch. I had
forgotten that bit. It never comes on time, and that's been another huge complaint. It never comes on time, and if something's meant to be a monthly allowance and you don't get it monthly, you begin to do it. You begin to incur costs that accumulate. And then when it comes, you at the end of the day, you end up spending more than you would.
So it's really continues to be a challenge.
The internship policy. So I would imagine that when this policy was being created, some doctors within the ministry and the policymakers involved doctors. Do you think this is what happened?
I'm sorry to laugh about this. But well, I can tell you I'm one of the NEC members. NEC is National Executive Committee for the Uganda Medical Association. We have a president, vice president, secretary general is up to us, the lower people. But I can tell you confidently, without shying away, that we were not consulted. Not even the elders, not even any of these professional associations we were consulted. Yet ideally, we expect that for any policy like that, of such a magnitude, before it comes to be passed, at least there should be some consultations to find out what the stakeholders think, what the elders think, what the, the
one
teachers,
would expect,
one would expect
that
consulted.
A policy concerning medical training and internship, somehow stakeholders in medicine would be consulted.
But that never happened. And we find that to be very, very unfortunate. And probably that's why it's getting all this resistance, because had we been consulted, definitely wouldn't allow for such a policy that deprives interns of the basics and the basic salary, the basic allowances. I mean, there's no way we would allow for this. So we were not consulted, and neither were the pharmacists, no nurses, no dentists were consulted, which we find to be quite unfortunate. It was a step that was missed, but yeah, that's where we are.
That's where we are. So what's the way forward?
We have strongly rejected this policy. We've done everything. We've written letters, not one, not two. We've engaged our elders who have written a very good policy document. But all in all, we've strongly rejected it. We've strongly rejected this policy in the current form. We believe this, much as we need an internship policy, because for a long time we've not had an internship policy. There's always been a need for us to have an internship policy that sort of guides and directs on how internship should be conducted, and we've always not had any. So we want to treat this first one as the first draft, that upon consultations and discussions, it can be improved. Some adjustments can be made, and we come up with a policy that can suit our current interns and can suit our demands. Otherwise, for now, we strongly reject the policy in the way it is. Interns are rejecting it. All cadres in medicine, in health, even the patients themselves are rejecting it. So we strongly reject it, and we hope it will not be passed in the current form. However, with modifications, it can. But this policy has some good elements in it. There's some good attributes to it. So we don't want to say that the policy is entirely bad in a way. No, there are actually some good things. We appreciate the attitude. We appreciate the spirit in which it's coming. We feel like there are some good attributes. However, there are unfortunate bad attributes in this policy are very, very disastrous, and I feel like it should not pass in the current form.
Okay, so there was this progression where a few years ago we started at 2.5 million to be paid to interns and senior house officers. Take us through that progression briefly, how we went from 2.5 million down now to where we are, where we are guessing it's going to be maybe 500,000 to 1 million. Take us through that progression briefly.
Okay. Okay. So I have that memory in my head, because I remember I did my internship 2019, 2020, and all that period you are earning just 1 million. Very small money that I'm always embarrassed to mention about, but that's what you are earning. But then the cohort that followed us, they first earned this 1 million for some time. Then there came a presidential directive that this money should actually be increased to a half what the medical officers were earning at the time.
Following some UMA advocacy.
It was a lot of advocacy. Personally, I was part of some of it. We were on the streets. We inhaled a lot of tear gas. But basically, yeah, we put up a strong fight. We felt like the 1 million was not enough. And our cry was heard. An arrangement was made to meet the president of the country to discuss about these amounts. And the president made a directive that let interns and senior house officers earn a half of what their bosses, who are for medical interns in this case, would be the medical officers. And at the time, medical officers were earning a gross of 5 million. So the half of the 5 million was 2.5. Yeah, so the president made that directive and it was passed. And it was implemented. But guess what?
2.5 was to be earned by the senior house officers.
Both of them, yes.
And the medical interns.
Yes. Though ideally, maybe senior house officers would have and a little bit more, because by senior house officer, at least you've passed the level of medical officer and probably you should be earning half of what specialists are earning. But nevertheless, it was passed that they would just earn just 2.5, half of what the medical officers were earning. And this money, it came through. Some of my friends got it.
It came through. Yes. So it came through for how long?
It was a very short time. I don't think I can put the actual months, but it was about 6 to 8 months. It wasn't a whole year. It was a very, very short period of time. And then this money had to be cut back to 1 million. Of course, at this stage, the presidential directives, we don't know what happened. Of course, seemingly there's a lot of politics that happened behind those.
So no explanation was given. 2.5 came through for the first about 6 months to 1 year.
Yes.
And then suddenly it was reduced to 1 million. No explanation.
No explanation was given. At least as far as I'm concerned, because probably the explanation is there. Some of the people watching here could probably be knowing the explanation. They can educate us in the comment section. But yeah, at least I've not seen an explanation of why this money had to be cut from 2.5 to 1. And we continue to demand that at least this money be pushed there. And as a matter of fact, this money is still not enough because so many things have changed. There's a lot of inflation, so many needs. So I feel like this money actually should be increased to 4 million.
Anyway, so we went from 2.5. It came for some time. Then it dwindled to 1. No clear explanation. And still coming irregularly.
Yes.
And then now we've come down to this whole crisis.
Yeah.
Where it's they're saying that even that 1 million is now in question. Should they get it? Should they not get it? So that's where we are.
And I don't know if I may ask you a personal question. I don't know if you have siblings or some children or babies. I don't know if you would encourage them to do medicine. I mean, even I will also ask our viewers out there if you would encourage, given all these circumstances that are happening, all these situations that are happening, would you really encourage somebody you care about to do medicine, given the current times and issues?
Would I encourage my child to do medicine in Uganda?
Yeah. If you don't have to answer
short answer.
It's okay.
Short answer. With the current situation.
Yes.
Maybe in Uganda.
The way you take
maybe
it so
no.
long.
If you want a fulfilling life, if you want financial freedom, time freedom, and no, but I'm a proud doctor.
Yeah. Sure.
I love my profession. I've loved the professional side of it. I've loved who I am as a doctor. I admire who we are as doctors. So there, I would encourage someone to do medicine.
And besides, I mean, medicine is a bit noble. Medicine is a noble profession, and yes, we are not moved by money that much. What gives me happiness is seeing a patient come in and they're doing bad, and with just a few interventions, they're smiling the following day.
Absolutely.
Yeah.
That's priceless. That's priceless. When you see someone's life actually change, priceless.
So money is not all. Money is not it all. There's much more than money. Otherwise, if someone wants to become a billionaire, trillionaire, you know you have 1 trillionaire in the world. Elon Musk. Is there any other? So I don't know if somebody can become a trillionaire by being a doctor.
You cannot become a trillionaire by becoming a doctor. Yeah. But so that's where we are. That's the current crisis. That's the current issue concerning medical interns in Uganda. And this is we've openly rejected the internship policy. We've come out to give our view on this policy and why we think it's not fair and it's more of dodging the issue. However, we would like to welcome the new interns that are starting next month. Welcome to the profession. It's awful what's happening, but we welcome you and we do wish you the best in your internship.
I know internship is such a time, like it has its own dynamics, really. A lot of things, so many things are changing.
By the way, I loved internship. I don't know why. I did my internship in Barara Regional Referral Hospital and Kavale Regional Referral Hospital, and I loved my time as an intern. Yes.
I mean, I just feel like most of the things we did when we were younger, they had something really beautiful about them. As you grow, sometimes you may not actually appreciate the beauty with some of these things, some of the experiences, but as you grow along, you actually realize that actually some of these experiences were good. So I also enjoyed my internship. I had a good time despite the challenges. It's a good period to learn. There's a lot to learn, because at internship you're sort of becoming an autonomous healthcare professional. You're no longer doing things, yes, much as you do things under supervision, but at this level there's so much that you actually do. As an individual, you can make some decisions. You can make decisions between life and death. Okay, you can actually make so huge impact. So I feel like it's a good time. There's so much that you have to learn. People are transitioning from being, hostelers, staying in a hostel, staying in a hall of residence. Your meals are provided. Now you're transitioning into an adult. Like there's so much change. There's so many changes that happen. So it's a very good time. I hope you'll enjoy it. I hope you'll learn. And man, this is the time. And you guys are the ones in it right now. So make the best use of that time.
Okay, yeah. So let's wrap it up. So we have the current internship crisis, medical internship crisis in Uganda. 7 billion shillings has been released for the first quarter. It's not going to be enough to pay all the medical interns. Then we have an ongoing crisis of money dwindling from the president's directive of 2.5 to now even asking, are they going to be paid or not? So that's the current crisis. Let's wait and see.
Let's wait and see. We hope for the very best.
Okay.
Yes.
Thank you.
Welcome. Cut.